Keeping your distance is almost impossible in an overcrowded slum. The World Bank says over 1 billion people face a heightened risk of the coronavirus due to substandard living conditions in slums and other informal settlements, like in Brazil.
Since the population here in Rocinha is very high, it's believed, according to our weekly experience, that the contamination index and the positive index are high.
The United Nations says urban slums are highly susceptible to COVID-19 due to a shortage or unavailability of clean water, sanitation, housing, and other basic necessities. Welcome to the show. I'm Ben Fazulin in Berlin. For the first time in history, more people now live in urban areas than rural communities. And population growth is expected to take place almost exclusively in the world's cities and towns. The fast pace of urbanization is leading to a growing number of slums. Poor hygienic conditions and overcrowding make them much more vulnerable to the spread of a disease.
Asia is home to the world's largest slum, a Ranji town in Karachi, Pakistan. Some 2.4 million residents have to contend with a scarcity of water and gang violence. It's followed by Ciudad Neza, east of Mexico City, and Dharavi in Mumbai, both with around 1 million residents. 2 of the 5 largest slums are on the African continent, in Nairobi, Kenya, and Cape Town, South Africa.
People were expecting the virus would wipe out entire slums, but it hasn't happened like that. The Indian slum of Dharavi is being hailed as a model for containing the spread of COVID-19. It was widely reported to have flattened the curve, despite the lack of physical distancing and contact tracing. Officials admit not all deaths are properly registered, but health experts argue there could be greater immunity in India due to the high incidence of infectious diseases like tuberculosis. Still, if it's not a virus or viruses that are making life even harder for the poorest of the poor, lockdown made things even worse.
About 1 million people live in the sprawling slum of Dharavi, known for its multicultural and entrepreneurial spirit. With its large migrant working class population, Dharavi was expected to experience a massive COVID-19 outbreak earlier this year. Instead, it effectively contained the spread of the virus, drawing global attention. To control the COVID situation here, the authorities resorted to measures like aggressive testing and screening, organizing regular awareness camps and quarantine centers, defining containment zones, and a harsh police clampdown. The shutdown of all work back in March due to the nationwide lockdown hit Dharavi hard. The thousands of small businesses and workshops that had been thriving there came to a standstill. Mohammed Akhtar has lived in Dharavi for 30 years, working as an artisan doing zari or thread work on fabrics. After months of sitting idle, Akhtar has just resumed work in his workshop.
Earlier, I used to get orders from clients, but now I have to go out and look for them. And I still don't get much work. There's been a lot of loss. I have to pay the room rent and the electricity bill.
He says he has never seen a slowdown like this. 6 months on, with economic activity limping back to life, most people, like Akhtar, are still struggling to earn a living.
All work has been severely affected. The economy was already in bad shape. Now, because of coronavirus, people have lost whatever savings they had.
Authorities in Mumbai, meanwhile, are bracing themselves as Dharavi has begun to see infections rising again as restrictions are eased and migrant workers return.
We have to change our strategy. We cannot ask people to sit at home now. So what we have to do is we have to provide them ample number of beds in case of emergency. We have to keep on testing them.
The regular hustle-bustle is returning to the streets, so the changing situation may still require a major overhaul in Dharavi's corona containment strategies. Akhtar is hoping things will pick up a bit once his craftsmen are back from their villages. But he is still expecting it to be hard to make a good living for quite some time to come.
John Friesen is a trained engineer and is doing his PhD on the scale of slums within cities. He says determining their exact size is vital in working out their infrastructure and healthcare needs, especially in a pandemic. So, John, what do we know about COVID-19's effect on slums?
Hi, Ben. Recent cross-sectional studies in different slums in Bangladesh, Kenya, Nigeria, and India showed that with COVID-19, we see a reduction in access to healthcare services in all sites, including preventive services. And we also see that the cost of healthcare increased by the household income of the slum dwellers reduced, which was also confirmed by the latest report of the Welthungerhilfe published yesterday.
So basically, it sounds like things are going from bad to worse. You've studied slums. What are your key findings that make this fight against corona even more challenging?
I think the greatest challenge is the lack of information in different aspects. So first of all, when we think about COVID-19, we know that people with cardiovascular diseases are at higher risk for severe causes of COVID-19, but we don't know how many people in slums have cardiovascular diseases, and the findings we have are sometimes contradictory. And second, we have to say that what we know about the health of slum dwellers is often limited to very specific areas. For example, to Kibera in Nairobi or to Dharavi in Mumbai. And a study of ours, like you mentioned, showed that the majority of slum dwellers does not live in these huge settlements, but lives in very small settlements. Most of them have the size of nearly a soccer field. And third, we have to say that that we don't know exactly how many people live in these kind of settlements. When we look at Dharavi, the population figures vary between 200,000 and 1 million persons, a factor of 5, and so we simply don't know how many persons we are talking about.
But John, certainly we could find out these things. I mean, what do we need to find out about these slums to come up with the right solutions? I know you're talking about a huge amounts of people in very small areas, but what do we need to know?
Yeah, but I think I have to repeat. I think the most important information is to know how many persons are living there, because if we want to provide infrastructure for basic needs such as sanitation or healthcare, we have to know how many persons are living there. And another fact I would mention would be that we have to be aware of the regional differences to take adequate countermeasurements, like. So we have to know what are the similarities or the differences between a slum in Bangladesh and a slum in Kenya, for example.
Will the pandemic bring the situation of people in slums into greater public focus? I mean, an outbreak in a slum can threaten the rest of a city and very quickly.
I hope so. I mean, this interview shows that we are concerned about these people, about these underprivileged people. But what I think is important to mention is that we often call slum dwellers the invisible or the poor. And in my opinion, it is especially important to perceive them not as the others, but to perceive them as part of our global community, which we are jointly responsible for.
So it's awareness that's so important. But are slums here to stay? Are they part of a reality that just won't change?
I think that's a very, very tricky question. Since the enormous number of people currently moving into cities worldwide cannot be observed by which we call planned or formal settlements, I think these slums or informal type of settlements are a necessary part of urbanization. But after all, people do not live there without reason. And I think the goal of us as a global community should be to provide them with basic infrastructure on the one hand, and on the other hand, give them the opportunity to move on and leave these settlements if they want to.
John Friesen, thank you very much for being on the show today.
Thank you.
And time to look into your questions about the coronavirus. Here's DW Science correspondent Derek Williams.
What about long-term complications? Will we see COVID-19 disabilities in the future?
Doctors are especially worried about the impact of heart damage in patients, since tissue death and scarring there is permanent and poses lifelong health issues. We'll obviously only know the long-term effects of COVID-19 on survivors when much more time has passed, but there are already indicators that those effects will be significant. The doctor who treated British Prime Minister Boris Johnson last spring called the disease this generation's polio. It's a sobering prediction that implies that he at least expects long-term disabilities related to COVID-19 to grow common, and lots of other experts agree with him.